Hello everyone. In this series, we'll be talking about the basic aspects of diabetes. So let us first start with the various types of diabetes, the complications, screening recommendations and risk factors for diabetes. Now, as we know, diabetes is defined as a plasma glucose, fasting plasma glucose of more than or equal to 126 milligrams per deciliter, a postprandial plasma glucose of more than or equal to 200 milligrams per deciliter, or an HbA1c of more than or equal to 6.5%. Broadly, diabetes can be classified into type 2 and type 1 categories. Of course, there are other variants which we will talk about. The commonest variant is type 2 diabetes. So, type 2 diabetes primarily involves a decrease in insulin secretion because of defect in the pancreatic beta cells as well as an increase in insulin resistance. Now, this insulin resistance leads to, it means resistance to the action of insulin, and it is usually secondary to either genetic factors or lifestyle factors like a sedentary lifestyle, weight gain, inappropriate food choices, etc. On the other hand, type 1 diabetes has a more acute onset, and it is due to destruction of the pancreatic beta cells which secrete insulin. Hence, patients with type 1 diabetes need insulin therapy for not only glucose control but also for survival. Apart from these two broad categories, there are various other kinds of diabetes. For example, women in pregnancy can get gestational diabetes. We have pancreatic diabetes due to destruction of the pancreas as a result of acute or chronic pancreatitis. Drug-induced forms can also be seen secondary to medications like certain anti-cancer drugs, steroids, etc. There are monogenic forms of diabetes due to single gene defects, post-transplant diabetes, and so on. What we are more concerned about is the common garden variant of type 2 diabetes, of course also with a knowledge about the type 1 diabetes variants. So, the various risk factors for type 2 diabetes include overweight, obesity, a family history of diabetes, women who have had a history of gestational diabetes in the past, those who have had PCOS, those who have given birth to a large baby, people who have hypertension, who have dyslipidemia. These are the categories of people who can get a type 2 diabetes. Hence, there is a recommendation for screening for diabetes in the general population. So, as per Indian guidelines, screening for diabetes is recommended for all patients who are above, all people actually, who are above 30 years of age, and also in those who are above 25 years of age, along with one of the above mentioned diabetes-related complications. So, remember, early screening means an early diagnosis, and early diagnosis and appropriate treatment goes a long way in preventing what is called as the diabetes-related complications. Thank you.